Comprehensive Guide to Thoracic Outlet Syndrome. The video is created by Dr. Abhinav Gupta and team. In this video we have covered everything about the topic from initiation to the end. Thoracic Outlet Syndrome, TOS, is a condition characterized by compression or irritation of the nerves or blood vessels in the thoracic outlet. The thoracic outlet is the space between the collarbone, clavicle, and the first rib. This compression can lead to various symptoms and may be classified into three main types. 1. Neurogenic, TOS, compression of brachial plexus. Symptoms: numbness, tingling, weakness, or pain in the arm or hand may worsen with overhead activities. 2. Vascular, TOS, compression of subclavian artery or vein leading to reduced blood flow, while venous compression can cause blood clots. Symptoms: swelling, discoloration, or pain in the arm. 3. Non-specific or disputed TOS. Symptoms: vague symptoms that may not fit clearly into neurogenic or vascular categories. Controversial in terms of diagnosis and treatment. Causes and risk factors. Anatomical factors: abnormalities in the anatomy of the thoracic outlet. Trauma or injuries, accidents or injuries that affect the thoracic outlet area. Repetitive movements, certain occupations or activities involving repetitive arm movements. Poor posture, prolonged poor posture, such as slouching or forward head position. Muscle imbalances, weakness or tightness in certain muscles around the neck and shoulders. Torticollis, also known as wry neck, is characterized by the involuntary contraction of neck muscles, causing the head to tilt to one side. Clinical features. 1. Head tilt, inclination of the head towards one shoulder, resulting in an asymmetric head position. 2. Head rotation, difficulty turning the head to the opposite side, leading to limited range of motion. 3. Muscle stiffness, stiffness or tightness in the neck muscles, particularly on one side. 4. Pain and discomfort, which may be constant or exacerbated by movement. 5. Asymmetry of the face. In some cases, it may cause a noticeable asymmetry in facial features due to the head tilt. 6. Shoulder elevation. The affected shoulder may be elevated or drawn upwards. 7. Compensatory movements, such as tilting the trunk or adjusting body posture, to accommodate the head tilt. 8. Muscle spasms, involuntary muscle spasms in the neck, contributing to the abnormal head position. 9. Limited range of motion, difficulty in moving the head through its full range of motion, particularly in rotation and lateral bending. 10. Tenderness or sensitivity in the affected neck muscles. 11. Secondary symptoms. There may be associated symptoms such as headaches, dizziness, or visual disturbances. Diagnosis. Physical examination, assessing symptoms, range of motion, and provocative tests. Imaging studies, X-rays, MRI, or CT scans may be used to visualize the structures in the thoracic outlet. Electrodiagnostic studies, nerve conduction studies and electromyography, EMG, to assess nerve function. Vascular studies, Doppler ultrasound or angiography to evaluate blood flow. Treatment approaches, medications, pain relievers or muscle relaxants. Occupational therapy, ergonomic assessments and modifications for daily activities. Surgery. In severe cases or when conservative measures fail, surgical options may be considered to release or decompress structures in the thoracic outlet. Physiotherapy assessment. 1. Patient history, onset and duration of symptoms. Nature and location of pain, tingling, or numbness. Identify aggravating factors and activities that worsen symptoms. 2. Posture assessment. Evaluate overall posture, including head, neck, and shoulder alignment. Assess for any asymmetry or abnormalities in the thoracic outlet area. 3. Range of motion, ROM, assessment. Evaluate the range of motion in the neck, shoulders, and upper limbs. Identify any restrictions or limitations in movement. 4. Muscle strength testing. Assess the strength of neck, shoulder, and upper limb muscles. Identify muscle imbalances that may contribute to TOS symptoms. 5. Neurological examination. Evaluate sensory function in the arms and hands. Check for motor strength and reflexes. Assess for any signs of nerve compression or irritation. 6. Palpation. Palpate the neck, shoulder, and thoracic outlet region for tenderness, muscle spasms, or trigger points. 7. Functional assessment. Evaluate how TOS symptoms impact daily activities and functional movements. Assess for any compensatory strategies or altered movement patterns. 8. Breathing patterns. Assess breathing mechanics, as dysfunction in the diaphragm or respiratory muscles may contribute to TOS symptoms. 9. Joint mobility assessment. Evaluate mobility and alignment of the cervical and thoracic spine, as well as the shoulder joints. 10. Provocative maneuvers. Perform specific maneuvers that reproduce or exacerbate TOS symptoms to aid in diagnosis. 11. Special tests. 1. Adson's test. Objective. Assesses vascular compression. Procedure. The patient's radial pulse is monitored while they turn their head to the affected side and extend and rotate their neck while taking a deep breath. A positive test is indicated by a decrease or absence of the pulse. 2. Roos test, elevated arm stress test. Evaluates for neurogenic TOS. Procedure. The patient opens and closes hands rapidly while holding the arms in an abducted and externally rotated position. Positive findings include weakness, numbness, or tingling in the affected arm during the test. 3. Right test, hyperabduction maneuver. Objective. Assesses vascular compression. Procedure. The patient's arm is fully abducted and externally rotated, while the examiner monitors the radial pulse. A positive test occurs if there's a decrease or loss of the pulse during the maneuver. 4. Costoclavicular maneuver. Objective. Assesses for compression between the clavicle and the first rib. Procedure. The examiner depresses the patient's shoulders downward and backward while monitoring radial pulses. A positive test is indicated by a decrease or loss of the pulse. 5. Halstead maneuver, military brace position. Objective. Assesses for compression between the clavicle and the first rib. Procedure. The patient assumes a military brace position with shoulders back and chest forward. Radial pulses are monitored, and a positive test involves a decrease or absence of the pulse. Physiotherapy interventions. 1. Posture correction. Emphasis on maintaining proper posture to reduce stress on the thoracic outlet. Education on ergonomic principles. 2. Range of motion, ROM, exercises. Gentle exercises to improve flexibility and mobility in the neck, shoulders, and upper back. Dynamic stretching routines to maintain joint mobility. 3. Strengthening exercises. Targeted exercises to strengthen muscles around the neck, shoulders, and upper limbs. Emphasis on balancing strength between opposing muscle groups. 4. Muscle release techniques. Soft tissue mobilization and myofascial release to address muscle tightness and trigger points. Techniques such as massage and stretching to alleviate muscle spasms. 5. Neural gliding exercises. Exercises designed to improve nerve mobility and reduce compression. Techniques to promote sliding and gliding of nerves within their sheaths. 6. Scapular stabilization exercises. Strengthening exercises to improve shoulder mechanics. Focus on the muscles around the shoulder blades, scapular retractors and depressors. 7. Diaphragmatic breathing exercises. Techniques to enhance diaphragmatic breathing, promoting relaxation and reducing tension in the upper chest. 8. Postural awareness training. Education on maintaining proper head, neck, and shoulder alignment during various activities. Cueing and feedback to encourage optimal posture. 9. Cervical traction. Gentle traction applied to the cervical spine to relieve pressure on nerve roots and improve overall spinal alignment. 10. Thoracic mobility exercises. Exercises to enhance mobility in the thoracic spine, reducing strain on the neck and shoulders. Techniques like thoracic extensions and rotations. 11. Functional training. Specific exercises that mimic daily activities to improve overall functional capacity. Incorporation of TOS-specific movements to address symptom triggers. 12. Patient education. Detailed information on TOS, including causes, aggravating factors, and self-management strategies. Guidance on lifestyle modifications to prevent symptom recurrence. 13. Progressive relaxation techniques. Incorporation of relaxation techniques such as deep breathing and guided imagery to manage stress and reduce muscle tension. 14. Home exercise program. Development of a customized home exercise program for ongoing symptom management and prevention. Regular follow-up assessments are crucial to monitor progress, modify treatment plans as needed, and empower individuals to actively participate in their rehabilitation. Vote of thanks. Thank you for watching our video. We hope this information has been valuable to you. If you have any further questions or concerns, please consult our team for personalized advice.